and I'm the founder and CEO of MEG. We're a health technology company that works with hospitals across the UK and Ireland to get frontline healthcare staff more involved in quality management processes. Over the last 8 years, through working with staff, what I found is that they're all very good technically using mobile devices. They're booking their food, their taxis, their holidays, all through mobile and cloud technology. But when it comes to their day-to-day work environment, they're still heavily reliant on paper, Excel, sometimes other legacy web systems for conducting tasks like audits and incident reports. So in a lot of cases, they see it as a checkbox exercise. They don't really see any instant feedback from it. And in many cases, they just don't collect data at all. So what we found is that audit and quality managers don't have the information they need to bring about improvements in quality of care, and obviously patients are going to suffer in this environment. So we set about building a mobile and cloud-based quality management system. So what that is it allows staff to access documents or clinical guidance at the point of care, conduct audits, incident reports, surveys, where and when they need it on the mobile devices at the point of care. So we would have spent a lot of time working with like clinical experts across the UK and Ireland, configuring like a vast array of different audits based on all the different standards. And we're delivering this through a very easy to use mobile interface. So if you go to the App Store now, you can download our Audit or eGuide apps, just search for MEG Audits, and the design is very simple, intuitive, very easy to use. So like even non-technical staff can use it quite easily and comfortably. And one of the key reasons they can do that is because we've got it configured to local standards. So as I said, you can select from a lot of preset CQC or IPS standards, or alternatively we can set it up based on your local audit standards. So rather than you having to change your workflow to suit us, we can change our system to suit your local workflow. And rather than the audit being just a simple checkbox exercise, we're also able to generate quality improvement plans in real time as well. So if one of your staff is doing an audit and they see a non-compliance, they can take a photo, take some voice recording, and all of that goes into a generated real-time quality improvement plan, which can be risk rated, and you can assign it to one of your colleagues to be actioned. All of the data that's then collected from your various staff across the different sites feeds into a management dashboard. The management dashboard is a series of different reports that can be generated and configured. It gives you run charts, heat maps of compliance across different locations by different staff, and this is all fully configurable and adjustable as well. And if you are using third-party systems like Power BI, we do have export options as well, so we can integrate with other systems that you already have in place if required. And as I said, this can always be tweaked and configured as you go forward. And the key benefit of using a system like this, like the obvious one, is time saving. So removing all of the manual and paper-based processes reduces the admin burden hugely. And you probably have some very senior staff in the hospital spending a lot of time on manual paperwork. So you're freeing up all of that resource to spend time with patients. And quality and audit managers then have data that they can use to identify and bring about improvements in care. And that would be clients like Neil Wigglesworth and Guy's and St Thomas in London. Up to November 2017, they were using another digital system called Wafer for conducting audits, and at that point they changed to using MEG. So this is rolled out across all 3 acute sites and community sites, and they did a before and after benchmark study on time savings. So this was published at a conference in Glasgow a couple of years ago, at an IPS conference. So the amount of time spent auditing was reduced by 50%. And the amount of time like writing up monthly action plans and reports was reduced from 2 days to just 45 minutes per staff member. And what that meant is they got real-time visibility of issues that need to be addressed and fixed, and obviously a huge impact on the patient care then. And importantly as well, in a large trust with 3 sites and 80 community sites across South London, they were able to roll it out quite simply. So in 1 month we got about 700 staff on board with very little training and no disruption. They even coined the phrase "just meg it" whenever they want to do an audit. So they got real buy-in from the staff then, and they really use it effectively. And over the last 4 years, we've been rolled out in over 60 hospitals now across the UK, Ireland, and even further afield. This is having a huge impact on, on staff buy-in. It's saving a lot of money, as referenced here by Gary Turkle, the audit manager in the Christian Manchester. So we're very keen to work with new hospitals. So, if you want to have a chat to any of these people, please get in touch with us and we can give you an introduction. The system has also had some fairly rigorous third-party validation of it. The ECRI Institute, a research body in the US, did a 6-month survey of hygiene software systems a couple of years ago. And they published a report that went out to most of the private hospitals in the US. And on that report, we were the highest ranked company out of the 14 they looked at. Obviously, the obvious impact of all of this, can be measured through time savings. So if you're doing 5 audits in a 40-ward hospital, and assuming a time saving of 60 minutes through the audit and action plan writing element of it, you're looking at a 10,000 hour saving per year. So you're looking at $250,000 in savings for a 40-ward hospital, and the cost of our system varies depending on the number of audits and modules, but you're looking at over €200,000 in savings from rolling out a system like this. And aside from that, there's the other saving of engaging your staff in the process. So if your staff feel that their audit now makes a difference, they won't see it as a checkbox exercise. They'll be more engaged and be more inclined to conduct audits and action plans if they can see a real-time difference. And obviously there's huge benefits for everybody buying into a process and a workflow that you manage. It is very simple to use. I'd be happy for anyone, if you want to just open your phone now and search for MEG Audit, you can download it and try it out. And one of my staff will be in touch to configure an account for you to look at. It really is that simple to use. I'll actually just show you a quick trial just to show you how easy it is to use. So as I mentioned, the app can be used on any mobile or web-based platform. So what you're looking at here is the app element of the system. So if you log into an account, you can choose which audit you're doing. So like there's hand hygiene, falls, slips, CQC. I think we'll look at PPE because that's fairly a hot topic at the moment. So these questions and formats can be reconfigured based on your different requirements. So say if you're looking at a surgeon, is it donning or doffing? If you choose donning, there's a set of questions. If you choose doffing, a different set of questions. So it allows you to collect this data on a mobile device very quickly. As soon as you've collected the data and submit it, it automatically generates a report that's emailed to your own email address. So it tells you when the audit was done, who did it, and what the compliance was with the different standards on that audit. And then all the information then goes into like a real-time dashboard across the whole of the trust. And that will give you like a heat map overview of compliance with the different standards by the different locations, which is color coded. And there's various options for searching and different dashboards. So you can export that data to third-party systems, or you can even access the quality improvement plan section, which tells you the issues that were raised on audits. You can assign them to people for risk rating. You can change the status from open and closed. So all of this can be fully configured through the settings area. So unlike other systems, we give you the ability to configure all of these formats, whether it's questions, dashboard layouts, locations that can be audited. So we want to hand back the power for doing audit to our customers. So we'd really love to work with some new hospitals in the UK. We're a relatively new product. We do have staff on the ground in the UK and Ireland, which can help you get set up and can make sure that it's tailored to your needs. So go to our website and click on the link free trial, and we'd love to hear from you. Thanks for your time and enjoy the rest of the conference.